Hey there, everyone. Ready to dive into something really important for your business.
Oh, yeah, this is a big one.
Today, we're going to be talking all about HealthChoice.
Uh-huh.
Those employee benefits you can get through the Association of Washington Business, or AWB for short.
Right.
I'm guessing that you're listening to this because you're either thinking about signing up for HealthChoice or you're just trying to figure out what's so special about it.
Yeah, makes sense.
Well, let me tell you, one of the things that really stood out to me was that HealthChoice has 21 different plan options.
Wow, that's a lot.
And get this.
What?
In-network diagnostics are 100% covered on most plans.
Oh, wow.
I mean, talk about peace of mind.
Yeah, no kidding.
That's pretty impressive.
It really is. What's really cool about HealthChoice is that it's not just some new program.
Right.
It's been around for almost 30 years.
Wow, nearly 30 years.
That really says a lot about how stable it is.
Yeah, that's a good point. Nearly 30 years in healthcare.
Yeah.
Especially with how much things change all the time.
Exactly.
That's really impressive.
It makes you think about what they're doing to stay around that long.
Makes you wonder what they're doing right.
Uh-huh.
What's the deal with Primera Blue Cross?
Oh, yeah. So HealthChoice is actually powered by Primera Blue Cross.
Okay.
That means that it can use Primera's network of providers and services.
Ah, that explains why they have such a big network.
Yeah, and it's all over Washington. You're not limited to just a few places.
That's awesome. And it's not just medical coverage, right?
Right.
I was reading that they also have dental and vision.
Uh-huh.
And even life insurance.
You got it. HealthChoice has a pretty comprehensive.
Okay, so it's all together.
Yeah, that's a huge plus for businesses.
Yeah, I bet. So who exactly can sign up for HealthChoice?
Well, it's for AWB member employers with at least 2 employees.
Okay, so not just for huge companies then.
Not at all.
Good.
Actually, almost 90% of AWB members are small businesses.
Wow, 90%.
They have less than 10 employees each.
That's a lot of small businesses.
Yeah.
So this is really made for those companies.
Pretty much.
You know, those small to medium-sized businesses that are so important to Washington.
The backbone of the economy.
Exactly. I'm sure there's some more specific rules about who can sign up, right?
Yeah.
Like, are there some industries that they can't get it?
You're right. There are some requirements about which industries can sign up.
Oh.
If you really want to know if you can get it,
Right.
the best thing to do is reach out to AWB directly.
Okay. Yeah, always better to go to the source. Now let's talk about those 21 plan options.
All right.
I gotta say, that's a lot of choices.
It is.
Why do they have so many?
They want to make it flexible.
That makes sense.
HealthChoice knows that businesses and people all have different needs and different budgets.
Makes sense.
That's why they offer 14 PPO plans,
Okay.
4 HSA plans,
Okay.
and 3 HMO plans.
All right, so PPOs, HSAs, and HMOs.
Yeah.
For some listeners, that might just sound like a bunch of letters.
Yeah.
Can you explain what each one is?
Sure.
Let's say that you're a small business and you have a bunch of young and healthy employees
Okay.
and they want to be able to see any doctor they want.
Gotcha.
What kind of plan would be best for them?
I would say a PPO,
Okay.
a preferred provider organization plan.
PPO.
They're really flexible.
Okay.
You can go see any doctor in or out of the plan's network.
So they have more freedom, but they might have to pay more if they go out of network, right?
That's the trade-off, yeah.
Okay, I see.
But for young, healthy people who want to see any doctor they want,
Right.
that flexibility might be worth it.
Okay, that makes sense. So what about if you have a business and you really want to keep costs low,
All right.
even if it means you can't go to any doctor you want?
Uh-huh.
What would you recommend then?
Well, an HMO might be good.
HMO.
Yeah, a health maintenance organization.
Okay.
Usually they have lower monthly premiums,
Okay.
but you have to choose a primary care physician.
Okay.
And they have to coordinate all your care.
So you don't get to choose your doctor, but you save money.
Right.
What about HSAs?
Oh, yeah, those are becoming more popular.
They are.
An HSA is a health savings account.
Right.
They're paired with high deductible health plans.
Okay.
You can put money in before taxes,
Oh, interesting.
and then you use that to pay for healthcare expenses.
So it's kind of like a special savings account.
Pretty much, yeah.
That's cool.
It's great for businesses and people who don't mind a high deductible
Right.
and who want to save some money on taxes.
All right, so PPOs are flexible.
Yep.
HMOs help you save money.
Uh-huh.
And HSAs help with taxes and paying for health care.
You got it. And each of those has a bunch of plans.
Okay.
With different deductibles.
Yeah, so you can really customize it.
Right. Find the right balance between cost and what your employees need.
That's great.
It is.
I'm starting to see why people like HealthChoice.
Yeah, me too.
So I'm starting to get how HealthChoice works, you know, all those different options.
Uh-huh.
But I'm curious how it actually works for real businesses.
Oh, yeah.
Do you have any examples?
Absolutely. HealthChoice has been around for almost 30 years.
Right.
So there are a lot of businesses that are happy with it.
Okay.
One that comes to mind is Fulcrum Environmental Consulting.
Fulcrum Environmental Consulting, I feel like I've heard of them.
Yeah, maybe.
What do they do?
They help make healthy environments for their clients.
Oh, wow. That's kind of perfect for this topic.
It is, isn't it?
That's funny. So they're really serious about health?
They walk the walk.
Exactly. But what do they like about HealthChoice?
Well, they've been using HealthChoice for a while.
Okay.
And they really like the coverage and how flexible the plans are.
Uh-huh.
And they said the customer service was really good.
So it sounds like they're happy with it.
They are. It's good to hear from real businesses using the program.
For sure, it's one thing to talk about it,
Right.
but it's another to see it working.
Makes a difference.
It does. But choosing a health plan is hard,
Oh, yeah.
especially for small businesses without a big HR department.
It can be tough.
What advice would you give to someone who's overwhelmed?
Well, I would say the first thing is to decide what's most important.
Okay, like what?
What are your priorities?
Okay,
What can't you live without?
right.
Is it keeping costs down?
Uh-huh.
Is it having a lot of doctors to choose from?
Okay.
Is it making sure certain conditions are covered?
Yeah, because there's no perfect plan for everyone.
Nope, you got to figure out what's best for you.
And once you know what's important,
Right,
then you can look at which plans match up with that.
exactly.
Okay, so let's say you've narrowed it down to a few plans.
Right.
What then?
Well, just pick the one with the lowest price.
Oh,
You
okay.
got to look at all the little details.
Right, those hidden costs.
Yes, you got to look at copays and coverage limits and prescription drugs.
Oh, yeah, I've had those sneak up on me before.
We've all been there.
Yeah.
And that's when HealthChoice's customer service can help.
Oh, okay.
If you have questions about the plans,
Right.
just ask them.
Makes sense.
They can help you compare and make a good decision.
So it sounds like they're really trying to make it easy.
Oh, yeah, they want to make it as easy as possible.
Yeah, insurance stuff could be so confusing.
Totally.
No one wants to spend hours figuring it out.
Nope.
It sounds like HealthChoice has a lot of good things going for it.
It does.
But are there any times when it wouldn't be a good fit?
Yeah, that's a good question. We've been talking about a lot of good stuff.
Mm-hmm.
But you're right, not everything's perfect for every business.
Exactly.
Are there any things that people should watch out for?
Well, one thing to think about is the network.
Okay.
Even though Premera Blue Cross has a big network in Washington,
Right.
there might be some doctors or places that aren't covered.
Yeah, out-of-network costs can be a pain.
And so it's important to make sure that the doctors your employees want to see are in the network.
Definitely, especially if your people need certain kinds of care.
Right.
You also got to think about cost.
Uh-huh. We talked about how they have a lot of different plans for different budgets,
Right.
but you have to be honest about what you can actually afford.
For sure. You might have to talk to your employees about what they want versus what the business can pay for.
Yeah, that's a good point. Transparency is really important.
It is.
And it's always a good idea to shop around, right? Don't just assume HealthChoice is the cheapest.
Yeah, compare prices from a few different companies.
Sometimes a small difference in the monthly cost can add up to a lot of savings over a year.
Exactly. And don't forget about association health plans.
Right, like HealthChoice.
They have some special things to think about.
Like what?
Well, one big one is that you have to be an AWB member to get HealthChoice.
Oh, right. So if you leave AWB, you lose the insurance.
Exactly. That's something to keep in mind.
It is. What about location? We know HealthChoice is just in Washington,
Right.
but are there some areas that have better coverage than others?
It's a good question. Premera has a big network,
Yeah.
but it's always smart to double check. Make sure they cover your specific area.
Especially if your employees are spread out all over the state.
Exactly.
So we talked about a lot of good things about HealthChoice.
Uh-huh.
All those different plans.
Right.
And the coverage and the flexibility.
Right.
And the support from AWB.
It's a good package.
But we also talked about some things to watch out for.
Yeah.
Like checking the network.
Uh-huh.
Comparing costs.
For sure.
And remembering that you have to be an AWB member.
Right.
So what's the takeaway?
Well, I think HealthChoice is a really great option for businesses in Washington.
Okay.
If you want good coverage and a lot of choices.
Right.
But like anything else, you have to do your research.
Yeah, you can't just jump in without knowing what you're getting into.
Exactly. You got to be realistic about what you need and what you can spend.
And do your homework.
Yep, exactly.
Well said. Don't just focus on the fancy stuff.
Uh-huh.
Take your time and really look at the details.
And remember, AWB is there to help you.
That's a good point. Ask them questions.
They want to help.
This has been great.
I'm glad.
But before we go, I want to leave our listeners with one last thought.
Okay.
When you're deciding on benefits, don't just think about money.
Right.
Think about the bigger picture.
Okay.
How will this affect your employees' health and happiness?
That's so important.
It is. And how will it affect your company culture?
You want people to feel valued.
Exactly. It's about investing in your people.
And making a place where everyone feels good.
Couldn't have said it better myself.
I tried.
Well, that's all the time we have for our deep dive into HealthChoice.
Thanks for having me.
We hope this helped you figure out what's best for your business.
We did our best.
Thanks for listening, everyone.